Good evening, everyone, and welcome to GAIA's second virtual fundraising event. My name is Jamie McDonald, and I am your host and fundraiser for tonight's journey. And yes, I do mean journey. You'll see. Now, I'm absolutely tickled pink to be back once again raising funds for GAIA, because last year was just so outstanding in the amount that we raised enough to let GAIA do what they needed to do in such challenging times. I mean, taking on one pandemic is tough enough, but taking on two, well, that's just Herculean. Now, tonight we are honoring the local heroes, the frontline healthcare workers. Tonight, we are going to go on a journey on the mobile health clinics and journey through the rural villages of Malawi and see firsthand all the great work that they have been doing and meet some great people along the way. Now, by now, you should have received your GAIA field kit in the post. So crack it open, have a look at the goodies inside. I want you to put on a hard hat, get your jacket on, put on your hard boots, and think about coming on a journey with us. Now, just very briefly, before I pass on the baton, just a quick word about the fundraising. If you haven't registered yet, don't panic. You still have time. Either go to www.GAIAGala2021.com, or what we'd actually prefer is to be watching this on a laptop and use your phone and the QR code that you would see on your program or in an email that you got today or yesterday. It just helps with the visual on the laptop and then pledging on the phone. Now, I'll be back later in about 20 minutes to do the fundraising, so you have plenty of time to register. But in the meantime, our first pit stop is with Executive Director Todd Shafer. Over to you, Todd.
Good evening, everybody. Hi, my name is Todd Shafer. I'm the Executive Director of GAIA, and I'm thrilled that you've been able to join us tonight for this, our 20th and 20 plus 1 year anniversary celebration. As for many of you, 2020 was not the year that we had anticipated. Though we did succeed at helping to move Malawi up another rung on the ladder to healthcare accessibility, our team in Malawi had to do so with an added degree of difficulty. covered head to toe in PPEs. Somehow, though, they managed to make these past 12 months the most impactful year that GAIA's had to date. In fact, Malawi overall reached an almost unthinkable milestone this year. And it was many years in the making. 5 years ago, GAIA's board of directors made a decision, and that was to commit to the UNAIDS 90-90-90 goals everywhere that we work, which is to say that we would push to tip the epidemic towards extinction. And that set off a rash of HIV testing, linkage to treatment, and support activities that produced a stunning result. By the end of 2020, we learned that 75% of Malawi's HIV positive population became virally suppressed, meaning not only that they're healthy, but that if they stick to their therapy, they are now non-infectious. They have achieved 90-90-90, and the end is near within a decade for the AIDS epidemic in Malawi. That doesn't mean that our work is done. In fact, what it means is there's a big opportunity that we need not squander. In fact, implied in those numbers is the fact that there remain 200,000 HIV positive Malawians who are not virally suppressed. And there's a number of challenges in other areas as well. Though we've made great progress on malaria, with 43% fewer deaths over the past 5 years, we still see every month 1,000 children under the age of 5 at GAIA's mobile clinics for malaria. And with regard to COVID, though Malawi remains a shining symbol of hope for the continent, with fewer than 3% of the population vaccinated, we must stay vigilant. So in response, we're growing. Last month, we launched a new mobile health clinic in a new district. That's 5 new villages previously lacking access to healthcare that will now have it every week. Next month, we're launching another mobile health clinic. And we've also put 20 additional nursing scholars into the pipeline to add to the 500 nursing scholars that we've graduated in Malawi and Liberia and who are now serving in rural areas throughout those 2 countries. As a result, I want to bring it back to what I said at the beginning. I said somehow we've managed to have our most impactful year to date, but there's no mystery as to how. The answer is the people. The answer is the incredibly tireless, committed, passionate staff. What we're talking about is the frontline healthcare worker staff of GAIA, the ones we're celebrating here tonight. And you'll have an opportunity to meet many of them. You've already seen dozens of them on their names and photos, and you'll have an opportunity to see many of them in action. And you'll hear from several as well. You'll meet Mpatso Piri, who was one of GAIA's original clinical officers from when our mobile clinic program started, who has personally provided clinical care to 500,000 Malawian rural residents through those mobile clinics during his tenure. You'll meet Monica McKenna, who we first met in our orphan program when she was a child. But later on, she went through our Nursing Scholars Program, and today she runs an outpatient clinic at a rural hospital. You'll meet Dr. Adres Malata, an internationally renowned nurse midwife educator, who also happens to be one of the first women to run a major African university. Last year, we gathered with a lot of fanfare to celebrate, our first take on a 20th anniversary. And you heard from celebrities like Anthony Fauci, Tom Brokaw, Robin Roberts, and more. This year, though, I think those celebrities would agree that the real stars are coming out. The brightest of those stars is our next speaker. Joyce Jere is GAIA's country director and unquestionably the finest hire that I've ever made. Joyce is able to juggle finance, program, and executive responsibilities while supporting the team of 90 frontline workers that she has built. But I would be remiss if I didn't mention the fact that Joyce is herself a nurse and midwife. So now, to introduce the 2021 recipients of the GAIA Global Citizen Award for their role in building the healthcare workforce that we're celebrating tonight, nurse, midwife, and country director, Joyce Jere.
Good evening. I would like to introduce to you the Gruber Family Foundation and the role they have played in funding the nursing scholarship in Malawi. I was privileged to meet Linda and her son-in-law, Chris, and they shared how passionate they are with the nursing scholarship program. Our audience, I would like to tell you how important the nursing scholarship program is. Malawi has a critical shortage of nurses, especially in the rural areas where access to health is a challenge. So by providing the scholarship to the nurses who work in these rural areas, we are able to combat and prevent maternal health, child health, and prevent COVID-19. Especially in the last year, our frontline workers, the nurses, really worked very hard in the prevention of the COVID-19. And because of these reasons, I would like to say thank you very much, our Gruber Family Foundation, and I would like to present the GAIA Global Citizenship Award to you, Linda and Chris. Thank you very much.
The Gruber Family Foundation has supported GAIA ever since its inception in 2003. Bill Rankin is a longtime friend of mine, and when he came to me with this idea of his plan for this incredible program, GAIA in Malawi, of course we signed on right away, and we've continued to support it since. And when Bill had the idea of the nursing scholarships, we jumped all over that because it was a win-win for us, for the country, for the nurses, for the healthcare thing, and for us. So we're proud to have been supporting it all this time. Thanks.
Yes, the Gruber Family Foundation is proud to have played a part in launching the Nursing Scholar Program. It's created hundreds of the Malawian healthcare workers that we're celebrating tonight, who've played an instrumental role both in the decades-long fight against HIV/AIDS and the current pandemic. The Gruber Family Foundation humbly accepts the GAIA Global Citizen Award and is honored to receive this award from an organization we've respected and supported for years. And having personally met Joyce and Nelson, hi Joyce, hi Nelson, I can attest that their professionalism and big hearts mirror the GAIA mission. GAIA is clearly in good hands where it matters. Bravo.
Thank you, Linda and Chris. The legacy of your generosity is apparent in many of the faces that we are celebrating here tonight. In fact, though it's hard for me to believe, I've been with GAIA for nearly a decade. And when I started, Bill Rankin, my predecessor, took me around to meet the most important and generous of our supporters. The very first of those meetings was with Linda Gruber. Thank you, Linda. It is now my honor to introduce Professor Adres Malata. She's a dear friend of GAIA. She is also the Vice Chancellor of the Malawi University of Science and Technology, and she's the first African midwife to be admitted as a fellow of the American Academy of Nursing. She's also the former principal of Kamuzu College of Nursing, which has trained most of the GAIA nursing scholars. She is a trusted advisor to GAIA and to me. And when Adres concludes, we will transition directly to a real treat. In late April, we sent a Malawian videographer out into the field with one of our mobile health clinics to try and capture a day in the life of our healthcare workers, a day in the life of a mobile health clinic. You're going to see what he came up with. You could see where the rubber really meets the dusty road. With that, to share a little bit about the importance of the healthcare workforce in the African context, Dr. Adres Malata.
COVID-19 has impacted Malawi, has impacted Africa, and also the whole world. In Malawi, we have seen the impact on education, healthcare system, agriculture, socioeconomic status of the people. So no one has been spared. The impact of this pandemic can be felt every day. A weak healthcare system collapses when there's a challenge like a pandemic. But when you have a strong healthcare workforce, you will actually survive even in difficult times like what we've just experienced with COVID-19. GAIA's framework actually does contribute to strengthening the health workforce in this country. Their framework is also good because they follow through all the students that have been sponsored until they graduate and also after graduation. And remember, it's not just about numbers of nurses or midwives, but also the quality of midwives. So GAIA works closely with the training institutions to ensure that the students are properly trained, properly educated to provide comprehensive care to the people, both in healthcare settings, but also in rural settings when there's provision of community health nursing. Majority of the students who are well deserving that get these scholarships are from poor backgrounds. I have personally seen students that have come on campus without anything. One student I saw a couple of years ago actually came to campus without shoes, walking on foot from the village. The nurses and midwives that have been trained under GAIA have helped to provide care. They have given comprehensive care in different settings in Malawi, and more particularly in rural settings where access to healthcare is limited. Therefore, I'm actually speaking for those who don't have a voice, that have received this care from these nurses and midwives, and will ever be grateful. And I'm sure the government of Malawi and the people of Malawi are grateful to GAIA and want to encourage GAIA to continue giving the scholarship, more scholarships for more students who eventually give back to the people of Malawi. Thank you, GAIA, for being a true friend of the people of Malawi.
This year has presented many challenges for GAIA. When COVID-19 reached Malawi, we felt the same fear and uncertainty that everybody did in these difficult times. But we knew we had to keep moving forward to provide life-saving medical care to hard-to-reach communities. Today, our mobile clinic is going to Itiza village. Our staff has to pack and transport all the supplies we need like soap, personal protective equipment, test kits, and medication, so we can treat our clients close to their homes.
The initial and the priority way was actually to make the mobile health team to be geared mentally, psychologically to assist people. That was the foremost thing. And the GAIA had to assemble all the PPEs so that we should go there whilst very protected ourselves and also protecting the community.
It's been very challenging in that we've seen so many cases of people coming to the hospital whereby they needed some help. So for us to cope, to help them with the little that we had, it was a very big challenge, but still the same with our management, trying as much as possible to source donors. They did sponsor us with some cash, of which we helped so many people in the villages.
When we all set up, one of our staff members, Edina, a community outreach nurse, welcomes our clients and talks to them about the importance of HIV testing, COVID-19 prevention, and in this case, the COVID-19 vaccine. We see more than 150 clients during an average clinic day. Our mobile clinic workers test them for HIV and malaria and treat pneumonia, hypertension, and other chronic conditions.
Pachipatala ndoti mankhwala aliwonse amatithandiza kutiyeza tiyeni kuti pasi mankhwala tiyeni tikakhalita mina kapena amalungo mankhwala aliwonse amatithandiza limene takhala ngati pina pake tadula kumapita kuboma tadula ulendo wopita kuboma chifukwa kuti mpata zami za GAIA akutithandiza kwambiri. bwana msiriza kuti tinganakhala bwanji ya chifukwa pakali pano chiopsezo tinali nacho chiopsa tinali pa chiopsezo koma GAIA atabwera matithandiza yonchi oti pakali pano tikamalowa muchipata koyambirira tikuyamba kuchapa manja tikachoka pamenepo tikachapa manja komanso pezeke munthu oti wavala chani wavala maski.
We provide clinical assessments and one-on-one counseling with a nurse or a clinician. When our clients have been diagnosed, we have stations to dispense their medication. Here, they will receive the necessary information about their medication and guidance for taking it safely.
Ndabwera kuti kuzathandizidwa mwana akudwala. Chifukwa utasanga chipatala chino chifukwa chipatala timachidalira kwambiri timachikhulupirira kwambiri timatithandizaso kwambiri bwera tikuvutika kwambiri ndipo tinasangala bungwe limene linabwera kuno ndipo tikuthandizika ndithu kwambiri bungwe lizabwere kuno ndipo osangalala kwambiri bwera tikuvutika kwambiri ndipo tinasangala bungwe limene linabwera kuno ndipo tikuthandizika ndithu kwambiri bungwe lizabwere kuno ndipo osangalala kwambiri.
Here in Malawi, we realized that we couldn't let COVID-19 prevent us from providing the medical care our communities need, because that care is now more important than ever. We are proud to serve on the front lines to protect and offer hope to the people of Malawi.
Wow, I want to go so badly. Hopefully soon. I looked at the guest list for tonight, and I could tell that many in attendance know GAIA really well. A lot of you have served on committees, event committees, program committees, finance committee, board of directors, and there's even a subset of you that has traveled all the way to Malawi to see our work in action. And all of you know that we run a very tight ship, and that a dollar goes a very long way for us. And in fact, we start each year with an ambitious program plan and only the vaguest idea of how we're going to pay for it. So we set goals for things like events like this, which we did last year, and remarkably, we overshot that goal. The direct result of that is the expansion of program activity that I described earlier. So we did the same thing this year. We've set an ambitious goal, $350,000 for tonight. That's enough funding to provide 4-year scholarships to 15 nurses, plus provide operating costs for 2 mobile health clinics. That would cover 80,000 sick patient visits. Now, $350,000 is a lot of money. But the good news is, before we ever gathered tonight, we'd already raised $250,000 through the sponsorships, ticket sales, and other gifts that were sent in prior to tonight. So our ambitious goal for this next part is $100,000. Let's see how far we can get. Back to you, Jamie.
Todd, thank you so much. And yes, we are ready for the fundraising part of the evening. So for all of you at home, I want to imagine we're mobile health clinic has pulled up to the debrief tent. We're getting out the vans and we're going in to sit down and talk about whether we can hit Todd's goal. Now, just a few pointers about how the fundraising is going to work. As I say, if you haven't registered, please do so now. GAIAGala2021.com, or even better, the QR code, which will lead you to donation page. Please just don't donate yet. I'm going to go through some levels, starting at $10,000 and working my way down. And all that I do is ask that please listen carefully to what each of the levels funds, because it's really, it's incredible what this organization can achieve with just the dollar amount that they've got. Now, the other thing is that when you do get to donate, you can either choose to do so anonymously or you can announce your name. Obviously, we'd love to see your names up in lights, but by all means, donate anonymously if that's your preferred method. And then lastly, if you haven't put your card details in and you just feel more comfortable sending in a check or cash, then please do so using the appeal card and writing to somebody at GAIA. All that I ask is, would you mind writing to somebody in GAIA and just letting them know today or tomorrow that you have sent some money in so that Todd can tot up the full amount. So without further ado, it is time to begin the fundraising. And as I say, we're going to do this collectively. It's going to be really fun. It's going to be communal. I'm excited. I'm getting worked up. And here we go. So let's start at the $10,000 level. Now, $10,000 is obviously a huge amount of money, but listen to how far it goes. This is what funds the beating heart of GAIA, the mobile health clinics, for 1 month. They get you up to 3,500 visits for patients. And listen to this, given what's been happening in the last 12 months, they're on track to visit 300,000 patients using these mobile clinics. It's an outstanding number. It's incredible. And I'm looking at you out there saying, do you know a better way to spend $10,000 than that? Well, if you feel that that is what you have in your firepower, then now is the time to do it. And I can already see some donations coming through. Jim Cashel and Ann Ching, $10,000 donation from you. Thank you so much. I also see Laurie Hunter and Jonathan McQuitty, $10,000 from you. You've just funded a mobile health clinic for 1 month. Thank you so much. I do also know that some of the chat channels are open for participants to chat to each other. So if you know somebody else who's watching, why not send them an encouraging message? Send one to Jim or Anne or Jonathan or Laurie and say thank you for what they've done. Anyone else? Here we go. We're racing. We're through $50,000 already. I can see Marty Arscott, Laurie, we said, Clark Kellogg, fantastic. Michael Lockhart, Philip McQuitty as well coming in. I can see the donations. Now, if you're holding tight for the lower levels, I'm coming to them. So we'll get there, but we're already off to a fantastic start. Wow, so encouraging. $5,000. $5,000 is the annual salary for one nurse aide. And this is what I've been thought of as the unsung hero level, because they are the people doing the administration, doing the medication, doing the logistics, that make sure that these appointments happen on time and the people that need their medication get their medication. So if you think $5,000 is something that you can afford, that skiing trip was canceled due to the pandemic and you feel that you have enough money to donate at the $5,000 level. I see Ashley Paff has just donated. I think that was $5,000. Thank you so much, Ashley. I see Michael and Julie O'Brien, $5,000. Michael and Julie, thank you. Chris and Bruce Brent, thank you. Another $5,000. This is fantastic. Come on, guys. We're getting up towards $70,000. Wouldn't it be great to get towards $100,000 even at these upper levels? So please do all have a think. Is $5,000 something that you can afford? Are you sitting next to someone who you think could afford $5,000? Ask yourself, is there a better use for that money? Because I tell you what, GAIA will show you how to spend it well. Moving down just one level then to $2,500. This is the all-important nursing scholar support level. I mean, we've heard so much about this nursing scholar program. 500 nurse graduates now within Malawi, which makes up, I think, 10% of graduated nurses in Malawi. And I read another statistic which blew my mind. In January, when they were taking their tests, passing their exams, it wasn't 80 or 90% of people that passed. It wasn't even 95% of people that passed. It was 100%. What does that mean? This works. Whatever GAIA's doing, it works. And they're doing a phenomenal job. So if you want to support the Nursing Scholar Program, let's do it there. I see people donating here. Dana Bickelman, thank you so much for your Sally and Bill Ranking coming at $5,000. Thank you, Bill Ranking. What a hero. Michael, as a Bruce Baber, $2,500. Linda Hubbard Guckler, $2,500. Thank you. Here we go. We're getting to that $100,000 mark. I'm so excited. Tim Mohan and Kerry Gustafson at $2,500. Ruth Thurman Scott and James Scott, $2,500. Thomas Pack and Meredith Fleck, $2,500. Thank you so much for showing your support for the Nursing Scholar Program. This is fantastic stuff. Come on, see if we can get to the $100,000 before we move down to the next level. I'll give you all a bit of a break. I'm running out of breath. Take a sip of your cocktail. Oh, sorry, this is just so exciting. Wonderful stuff. We're almost up to $93,000 now. Moving down one level to $1,000. This is the community-based health services. This really targets the prevention of the spread of HIV and looks to test 200 high-risk persons to try and stop the spread. I think the amount of people who tested positive for HIV was around 3%, so we're still not at zero. But as you hear from Todd, they're very optimistic that they can get to that number. I think we've all learned over the past 12 months that stopping the spread of these viruses is key to the general health of our communities. So if this is something that matters to you, oh, I've just noticed we're through to $105,000. This is great. Margaret Safer, Chris Kitch, Julie Whitcomb, thank you so much for your donations. I can hear the $1,000 donations coming through. Wonderful stuff. Kristen Nash, thank you so much for your donations. Wonderful stuff as we cruise towards $110,000. This is great. Please know that you can donate twice if you'd like to. I know I'm probably sounding a bit greedy, but I'm just saying it's not against the rules. Okay, moving down to the next level, which is $500. At $500, this is where you get to kit out for 1 year a clinic in uniform. Now, I personally find this is a very important level to be donating at because it creates a sense of unity. It creates a sense of community. And if you are watching this now, then maybe next year when you're watching the videos, you will look at those medical staff in uniforms and say, that was me. I contributed to that. And that's something you should be proud of. So $500, we're getting to a little more of the affordable levels here, perhaps 2 theatre tickets that you didn't get to spend money on over the past few months while things have been shut. Is that something you can afford? Think about just $500 and how far that's go. That's getting a whole entire clinic for a year. Amazing how far that money goes. Do you think you can spend that $500 any better? So please send in Janet Hunter, Junior Ronaldo, money coming in. We're almost at 120,000. I'm thinking to myself, can we make $150,000? Wouldn't that just be fantastic? $500 if you'd like to contribute to the level on uniforms. Moving down one more level to $250. I see we're cruising towards, we're through $120,000. I know that was a big milestone they wanted to get through secretly. So we're through there. $250 is the donation towards orphans and vulnerable children. Now, I know that vulnerable children and orphans are still a big issue in Malawi, and GAIA I think have helped almost 35,000 orphans since inception, which is an incredible amount. So for just $250, if you would like to support that particular program, please do donate now. That's $250 for the orphan and vulnerable child support. And we're actually going to pause just a second here because I'd like to introduce someone very special. Todd mentioned her earlier. Her name is Monica. She leads up a maternity unit in Malawi. And this is someone who did graduate through the Nursing Scholarship Program. But this is the real key. She hasn't just been helped by GAIA for the last 3 or 4 years as she was a graduate. She's been helped by GAIA since she was a child. It's a very moving story. So I please ask all of you to pay attention. Here's Monica.
I'm Monica Machina. Currently, I'm working with Outpatient Department 1, where I'm working as nursing officer in charge of that ward. So we have different cases each and every day, admitting different patients with different kinds of diseases like pneumonia, malaria cases, and we have minor theater where we can do some other operations there. My journey started when I was in primary school. My dream was to become a nurse, but actually there wasn't someone to support me. Then one of the friends told me that there's GAIA there, you can just go and negotiate with them, maybe they can pay school fees for you. I think GAIA has done a lot to me. Had it been I wasn't one of the scholars, I could have been here. Maybe I could have been home jobless and doing nothing. GAIA is there to motivate us, to educate us, and to be the children we can be. I'm very, very, very thankful. I'm here and I'm living my happy life.
Monica said that her dream was to become a nurse, and GAIA made that dream come true. Otherwise, she'd be at home doing nothing. Just goes to show, for those of you who just donated $250, you perhaps just made someone's dream a reality. If you think about it, it is a very affordable amount of money to do such an amazing amount of good. So for those of you who have not donated yet, can you afford $250? And can you produce such wonderful stories, just like we heard from Monica? Really moving stuff. Well, the last of our levels tonight is at $100, and it's the all-important PPE gear. I know that GAIA made up to, I think, 98% of their appointments on time. And of course, that's because of the wonderful people they have working on the ground there, but it's also because they had access to PPE gear. It's so important. So if you have just $100 spare, then please do donate it now. This is a great opportunity for anyone who hasn't donated yet to throw in $100. I see that we're up to about 90 donations so far, which is about half of the people who are on the call. So just imagine another 50 people donating $100 and we'd have another $5,000. So just think about it. I mean, obviously it's completely up to you. And I should also add that the closing of the donations doesn't end right at the end of this video. You can still donate for a few hours afterwards, or of course, send in money by check or cash. I should also say there's a bit of a fun thing that we do at the end, which is you can donate any amount you want. A lovely story I heard recently is someone had a daughter on the 23rd of June, 6/23, and decided to donate $623 as a memento of her daughter's birth. So I thought that was a nice way of maybe picking a number, or maybe you were born in 1978 like myself. That would be great. I'm just looking to see if I had any more donations. Brooks and Kathy Simpson, $1,000. That's fantastic. Thank you so much. You'll see how far that goes. Okay, well, there's not too much more for me to say other than, boy, would it be great to get to $150,000. So please, oh, Bruce and Chris Brent, $1,000. Thank you so much. That's just come in. Gosh, we're so close to 150. Well, I am actually going to hand it over to Todd in just a second. But as I say, the donations will still be allowed for another hour or two. So maybe you know someone who couldn't make this event. Give them a nudge and tell them the details if they want to donate. It's been a total pleasure working with GAIA once again. I did it last year, and obviously I'm doing it again this year. And they're such a fantastic organization. Todd and the team, I wish you all the best and good luck with everything. And Todd, I'll hand the baton finally back to you.
What a remarkable evening. Every time we do this, we set, the committee comes together and says, well, let's set this marker out there. And I always say that's absurd. People have already donated. They've already sponsored us. They've already sent in gifts. And then this happens and you exceed the goal. And there's a special reason why I'm happy that it happened tonight. And that's because Joyce and Nelson set their alarms for 2 a.m. and they're watching right now. And so they can see this support that's coming to them in celebration of them and the frontline healthcare workers in Malawi. Congratulations, Joyce and Nelson. You've inspired a lot of generosity. And before signing off, I just wanted to give a thank you to our event committee and to our sponsors and to our in-kind sponsors, and especially to the 3 people who made this possible, doing all of the logistics and administrative behind-the-scenes work. Ninan Palavicini and Chloe Frank from our staff, and Doug Hood, who oversaw the event planning. Thank you so much for what you allowed us to do here tonight. Now, in the coming days, I'll come back to you with a grand total. But I can tell you right now, we overshot the goal. With the 250 and the 140 right there, we did better than that ambitious goal. That's because of your generosity. I'm so grateful. I thank you. Next year, let's do it in person. As they say in Malawi, Zikomo Kwambiri. Thank you very much.